Good morning, everyone, and welcome to today's briefing on COVID-19 in New Brunswick. Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-parole aujourd'hui sont le médecin hygiéniste en chef, Dr. Jennifer Russell, et le Premier ministre du Nouveau-Brunswick, Premier Higgs. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Premier of New Brunswick, Blaine Higgs. Dr. Russell.
Thanks, Amanda. Good morning, everyone. Bonjour tout le monde. This week, New Brunswick has reached an important milestone. 75% of us over the age of 12 have received 2 doses of a COVID-19 vaccine. Is this a significant accomplishment? Yes, it is. Can we be proud that we have reached this goal? Yes, we can. Does it mean that COVID-19 is over? No, it does not. COVID-19 is still with us. As you know, it's a global pandemic, so it is in many, many countries around the world and still happening to our neighbors to the south and all across Canada. So we do need to be aware that every New Brunswicker who can get vaccinated should get vaccinated. We have cases active right now. The hospitalization rates are low, but we want to keep it that way. So in order to ride this next wave, which we are seeing increased numbers of cases across the country, you're not only protecting yourselves, but you're protecting those around you. As you know, not everybody can get vaccinated. Some people are immune compromised, and even if they do get a vaccine, it doesn't work as well in somebody who is completely healthy. So we have an obligation as citizens to be able to protect our entire communities, including children under 12 who can't yet get vaccinated. So perhaps some of you might feel cheated by this around the fact that, you know, we can't do everything we want to do right now and we're not back to normal. But that's the nature of COVID-19. And I do understand how you feel. And again, it's the nature of what we're living right now. Vous vous attendiez peut-être que nous aurions obtenu l'immunité collective après avoir atteint le cible de 75%. Vous vous attendiez à peut-être revenir à votre vie normale d'avant la pandémie, que vous soyez vacciné, oui ou non. Some will complain that the goalposts have been moved. Some may really find that confusing and frustrating. And to some extent, the goalposts have actually moved. But that's not by my doing, that's not the Premier's doing, it's not anybody else. It is the nature of the pandemic and the variants and the transmission that we're seeing right now. So the virus itself has moved those goalposts. COVID-19 has mutations. We have lots of different variants, including Delta, which we are seeing in our province, and these variants are more contagious and can cause more severe symptoms. So we have to adjust and adapt as we move through this phase while we're dealing with variants of concern. Depuis le passage à la phase d'alerte du plan de rétablissement du Nouveau-Brunswick, il y a 1 mois, le nombre de cas de COVID-19 a considérablement augmenté, ce à quoi nous nous attendions. Ces nouveaux cas se déclarent principalement chez les personnes non protégées. En effet, 90% des nouveaux cas depuis 1 mois sont des personnes qui sont partiellement vaccinées ou pas vaccinées du tout. And I just want to highlight the fact that Dr. Bonnie Henry out in British Columbia recently said that this is a pandemic of the unvaccinated, and I have to agree. We are seeing, again, higher rates of case numbers in unvaccinated people and obviously more hospitalizations in people who are unvaccinated. So while the infections do, again, circulate more amongst the unvaccinated population, the virus can then move to vulnerable New Brunswickers. So the virus can spread to elderly people, those with weakened immune systems, and as I mentioned earlier, kids under the age of 12. And so again, I need every New Brunswicker to really be aware that this is the battle we're fighting right now in terms of trying to keep our communities safe, to keep our people healthy, and to protect our healthcare system, which from the beginning of the pandemic has been our goal. It is up to all of us to protect them by protecting ourselves. And by this time next week, the new school year will officially be underway. And our schools will reopen and students will return to the classrooms. And for parents of students who are above the age of 12 who've had their vaccine, it's probably less of anxiety-provoking situation. For those people with kids under the age of 12, I'm sure that the parents are very, very concerned about what the risks are right now. But there is a plan in place that will allow students to have as close to normal a school experience as possible while keeping the standards high to keep every teacher and every student healthy and safe. And, you know, from an education component, we do know that the strains on students with respect to COVID in the last year and a half have been really tough. It's obviously affected some kids more than others and some families more than others. But again, at this time, as a collective, as a province, we do need to support all families and all children right now. The health measures that protected our school community during the last year are still effective today, especially if ensuring that you're fully vaccinated. And I was meeting with my team yesterday around, you know, our outbreak management and going through different scenarios and different types of outbreaks and cases, isolation of close contacts, et cetera. So we are very, very aware that the situation is evolving, and we're going to keep evolving with it. La vaccination constitue la façon la plus sûre et efficace de prévenir la propagation de la COVID-19. Si vous n'êtes pas encore complètement vacciné, n'hésitez pas. Prenez rendez-vous dès aujourd'hui auprès de votre pharmacien ou de la Régie régionale de la santé Horizon ou Vitalité. Et je suis vraiment contente que les cliniques sans rendez-vous sont vraiment bien. Il y a beaucoup de nombre de personnes qui sont faites vacciner dans des situations comme ça. Alors, j'espère que ça continue. C'est vraiment important qu'on continue à augmenter nos taux de vaccination. We know that based on scientific evidence as well as expert guidance and advice from the National Advisory Committee on Immunization, the safety of COVID-19 vaccine. I know that people have many different views on vaccines, and obviously the majority of people in New Brunswick have felt that they're safe and understand the science and find that information from credible sources, and I'll just come back to that. We had this same message at the beginning of the pandemic. Make sure that all of your information comes from credible sources. That means World Health Organization, Public Health Agency of Canada, CDC, and obviously GNB. So we really encourage people to follow that advice, and all the advice on vaccines and the information that we have is that we are very confident that we are protecting our population. We've already seen the effects of what high vaccination rates can do, and we want to continue with that. The vaccines approved in Canada are safe and effective. They are developed to meet the highest standards and are continually monitored for safety and effectiveness. For those of you who may still have questions on the efficacy and safety of the vaccines, please talk to your doctor, your pharmacist, a nurse practitioner. By getting vaccinated, you will be greatly reducing the chance that you will be infected by this virus or become seriously ill. And anecdotally, you can see on different social media platforms where physicians post about their experiences in places where COVID numbers and hospitalizations are very high, and they will look at the outcomes and look at the treatment path for people who have been vaccinated, who may have chronic medical conditions, and somebody who was healthy, who was unvaccinated. And it's very dramatic, the difference in how those diseases, how the disease outcomes affect people who are vaccinated versus those who are unvaccinated. So it is very, very clear, and the evidence is there that vaccination helps reduce the severity of the symptoms, helps reduce your risk for being admitted to hospital and ICU. And again, that goes towards protecting our healthcare system as well. You will also be limiting the opportunity for this highly contagious virus to reach those who are less able to protect themselves. Je vous prie de vous faire vacciner et d'encourager toutes vos connaissances à emboîter le pas. Il faut que le grand nombre possible de citoyens du Nouveau-Brunswick retroussent leurs manches pour se faire vacciner. Votre vie n'est pas la seule que vous pourriez sauver. We continue to see new cases of COVID-19 in New Brunswick, and while there is less severe illness and fewer hospitalizations, public health is still working hard to limit the spread of this disease. And I think people did have questions when we went to Green about what our approach would be, because we heard things like Alberta not continuing with contact tracing and isolation and things like that. We are absolutely continuing with aggressive contact tracing, isolation of contacts, etc. We are still continuing with testing. That is part of our approach right now that is helping us be successful. But the most important part of all of this right now in terms of our approach is the vaccinations. So to be protected against COVID-19, you need to be fully vaccinated, 2 doses of the vaccine plus 2 weeks after the second dose for the vaccine to be fully effective. Si vous n'êtes pas complètement vacciné, que ce soit par choix ou parce que vous ne pouvez pas recevoir un vaccin, je peux vous recommander de porter un masque à l'intérieur. La loi n'exige plus le port du masque comme c'était le cas au cours des premières phases de la pandémie. C'est un choix et c'est un choix qu'on exige au niveau de l'information que vous avez disponible sur le site web dans notre document sur le COVID-19 dans la phase vert. C'est vraiment beaucoup d'informations et contenu dans ce document. Alors, je vous recommande de lire ce document. We are not mandating that individuals wear a mask in public indoor spaces as it was during the earlier phases of the pandemic. We do have a great document online called Living with COVID, great information there, as well as a link to a document from Public Health Agency of Canada around assessing your risks for when to choose to wear a mask. Great document. I do encourage everybody to understand that it is going to continue to be a choice. And if you have concerns for yourself and for others who you come into contact with on a regular basis because you or they are at higher risk of COVID due to age, chronic conditions, or other reasons, the choice is yours whether you choose to continue to wear a mask in indoor public spaces. And I was speaking with a colleague recently around understanding risks based on the vaccine status of the people that you're with. It's not rude or inconsiderate to ask people about their vaccine status in the sense that to protect yourself and protect your loved ones, it is important for us to understand, and perhaps people, again, if you're not vaccinated, choose to wear a mask. We know that mask wearing in combination with other public health measures, washing your hands, maintaining physical distance, staying home when you're sick, helps to slow the spread of the COVID-19 virus. And I mentioned the Living with COVID-19 guide, which is available online as a resource, which provides an overview of ways our protective health measures can be incorporated to help protect individuals, businesses, organizations, and communities. And in the coming weeks, I'm sure that many New Brunswickers will take the opportunity to get themselves vaccinated. And again, things are going to continue to evolve and shift. We will continue to follow the evidence. We will continue to follow the data. And again, making sure that we all feel comfortable making the choice whether to wear a mask or not in different situations. And whether it's I know people who wear a mask even if they're fully vaccinated in certain situations. I myself included sometimes wear a mask, and sometimes it's as a result of having people that are vulnerable living at home, whether it's a child under the age of 12 or somebody who's immune compromised, or just a heightened level of anxiety. Some people, for whatever reason, may want to choose to wear a mask, and I do want people to be comfortable making that choice. Lorsque vous vous faites immuniser, je vous rappelle à tous d'être gentil envers les personnes qui administrent les vaccins. My goodness, I heard some stories about people who were very frustrated with vaccine mandates and policies from their employers, and they were taking their frustrations out on the people who were actually providing the vaccines. That is not acceptable. I do understand people can be frustrated when things like this occur, but it's not acceptable to take that frustration out on the people who have been giving this service for months and months and months, sacrificing time this summer with their families, etc. They deserve your respect. They have been working hard throughout the pandemic, and that is just not appropriate. So I want everybody to understand that when you go to get your vaccine, we expect that the staff will be treated with the utmost respect and courtesy. Les employés des cliniques de vaccination, les personnes qui font la recherche des contacts et les autres membres du personnel de santé publique travaillent d'arrache-pied pour protéger la population du Nouveau-Brunswick et sauver des vies. Toutes ces personnes méritent votre respect et votre compassion. As much as we need to be kind to one another, we also need to be kind to ourselves. So again, if you feel that level of frustration going up and you feel like you're not really able to express it in a healthy way, that's the time to reach out. That's the time to get support. You know, it has been a long haul. There's no question. It's been, 18 months of really dealing with some things that are really not completely normal in our lives for an extended period of time, and that can create a lot of stress and anxiety. So we really want people to be comfortable reaching out, being kind to one another and supporting one another. It's really important right now as we go into the fall. Je sais que bon nombre d'entre vous sont fatigués de la COVID-19, mais nous devons tous puiser dans nos ressources afin de trouver la force requise pour traverser la prochaine vague. And I know we can do this. Je sais qu'on peut faire ça. Prenez soin de vous, même lorsque vous prenez soin d'autres. Please be gentle with yourself, and when you need help, remember to reach out to a friend, a family member, or a professional for assistance. These resources are available to you when you need them. Nous avons fait beaucoup de chemin ensemble. Notre parcours n'est pas fini, mais nous avons espoir que des jours meilleurs nous attendent. And if we can all be kind to one another and to ourselves, I am confident we will get there. Thank you very much. Merci.
Good morning. Bonjour. This week, our province reached an important milestone, surpassing 75% of eligible New Brunswickers fully vaccinated with the COVID-19 vaccine. Today, that number stands at actually 75.5%, with 84.7% of New Brunswickers aged 12 and over vaccinated with their first dose of a COVID-19 vaccine. This is indeed something to be proud of. At the same time, the number of hospitalizations in our province due to COVID-19 remain very low. Yesterday, we had 3 people in hospital, including 1 in ICU. None of the cases in hospital in New Brunswick are children. And when we look at those hospitalized across Canada, only about 1% are children under 12. Our case numbers are staying relatively stable, with recoveries balancing out active cases. At this point, today's numbers are actually down again at 127 from the 160 a few days ago, with 21 recoveries today and 11 new cases. Comme le dit le Dr. Russell, parmi les personnes qui ont contracté le virus de la COVID-19 dans la province, 80% n'étaient pas pleinement vaccinés. Le haut pourcentage de vaccination au Nouveau-Brunswick explique pourquoi il n'y a pas beaucoup d'hospitalisations. Nous devrons continuer notre bon travail. When the decision was made to lift all mandatory travel and public health restrictions and move the province to green at midnight on July 30th, we did so with confidence in our public health recommendation that New Brunswickers had the tools and the knowledge needed to manage living with COVID-19. Nous sommes passés à cette nouvelle étape en sachant que le nombre de cas actifs allait augmenter, mais que la vaccination allait augmenter également. Malheureusement, la vaccination n'a pas augmenté aussi rapidement que nous le pensions, mais le nombre de cas a augmenté comme nous l'avions prévu. De plus, nous savions qu'il faut l'arrêté obligatoire de la province terminé. Il y aura encore des mesures de protection en place dans l'éventualité d'une exclusion de la COVID-19. As has always been the case, the Public Health Act provides public health authority and operational framework to act in the event of an outbreak of COVID-19 or any other virus. On top of this, employers and employees must adhere to the Occupational Health and Safety Act, which explains duties and obligations related to communicable disease transmission. We knew that COVID-19 wasn't going anywhere soon, but we also knew we were ready to move forward. The same is true as families across our province ready their children to return to school. I understand that some of you may be nervous, but the Department of Education and Early Childhood Development has a solid plan to ensure that safe return to school for both students and staff. Ce plan repose sur les leçons que nous avons tirées depuis le début de cette pandémie. Et l'objectif est d'assurer la santé de la sécurité de nos écoles le plus normalement possible. Si vous n'avez pas eu l'occasion de lire les lignes directrices pour des écoles saines et sécuritaires, je vous invite à le faire. The guidelines are available online at www.gnb.ca/education. And in addition, Dr. Russell and our Education Minister, Dominic Carty, will be taking part in media events tomorrow to take questions from viewers and listeners. Throughout this pandemic, we promise to be honest and upfront with New Brunswickers. That is what we have consistently done, and that is what we will continue to do. We have been in green for a month now, and living with COVID-19 has unfolded as we expected. Nous avons ouvert nos entreprises et notre province avec soin. Nous avons reçu nos amis, notre famille et les visiteurs dans notre province. Nous sommes retournés à une nouvelle normalité. As part of that, some people have continued to wear masks and some businesses have asked people to do so. This is no longer a requirement under Green, but it is important that everyone be allowed to make this decision for themselves, based on what makes them most comfortable, and these decisions need to be respected. Masks, like vaccines, testing, and monitoring for COVID-19 are all tools that can be used in our continued fight against this virus. Tout au long de cette pandémie, les gens de Brunswick ont fait de grands sacrifices afin de se protéger et de protéger leurs proches et leur communauté. Nous nous sommes adaptés selon les besoins et nous allons continuer de le faire. C'est important parce que le virus de la COVID-19 continue à changer en même temps que nous et en même temps que le reste du monde. We will continue to evaluate further ways we may need to adapt, including the introduction of vaccine passports and possible masking mandates. At this time, however, we do not have a situation to warrant further impositions. We will continue to work with public health and make our decisions based on science. Je sais que plusieurs personnes ont des questions concernant ce qui se passe dans les autres provinces. Si vous regardez les autres provinces du pays, vous allez noter que dans les provinces plus densément peuplées, la situation continue d'être très différente de celle que nous connaissons ici. Nous devrons déterminer ce qui est bon pour le Nouveau-Brunswick. We've asked people to get vaccinated for a reason. The last thing we want to do is penalize those who have taken the steps necessary to protect themselves, their loved ones, and our province. As for those who have not yet gotten vaccinated, we urge you to do so. Vaccine passport could be a way of doing that, as other provinces have seen significant increase in vaccinations once passports were introduced. We, in fact, are seeing significant increase in our vaccination rates now, possibly as a relation to summer ending and possibly as a relation to school starting. But in any event, we are seeing increased vaccination rates, and this is very, very encouraging to see that. We will continue to be proactive in our planning and take action when required. And that is how we will keep New Brunswickers as healthy and safe as possible in this constantly changing environment. Making vaccines mandatory in all parts of New Brunswick public service is a great example of how we are not just taking action, but we're willing to lead. We have gotten to this point by being leaders, working together and caring about one another. This has indeed been a team effort throughout the province, and it will continue to be so. It is imperative that we continue to do all that we can to overcome any challenges we face and emerge from this experience stronger than ever. Thank you. Merci.
Thank you, Premier. Thank you, Dr. Russell. We'll now proceed with questions from the media. Each reporter will have one question and one follow-up. You have the right to pose your question in the official language of your choice, and please ensure that your microphones are placed on mute. Nous allons maintenant procéder à deux questions de journalistes. Vous avez le droit de poser vos questions dans la langue officielle de votre choix. Chaque journaliste aura une question et une suivie. Veuillez-vous assurer de désactiver les sons de vos micros. Laura Brown, CTV.
Hi, Premier. I'm wondering if you've discussed New Brunswick situation, or if Nova Scotia and PEI have come to you with concerns about New Brunswick's situation in the last couple of weeks, and have discussed at all any changes to border restrictions?
No, they haven't, and we have a discussion. I did talk to the Premier-elect Houston on the day after the election, and we discussed health concerns within our respective provinces. It was primarily focused around kind of the next crisis, and that was moving from the pandemic into our health needs throughout the country and throughout our provinces, and the need to have an Atlantic kind of philosophy here and how we manage that. And he was very, very supportive of that and very encouraged that we would work on this together, because he recognized the significance, as certainly was a major factor in the election. But as far as harmonizing or changing the rules, I mean, I think what they're seeing now is that our case counts are declining. Our hospitalizations have not increased. And so I would expect that, they'll have their own path to follow here, but I would expect there will be likely a lot of conversations with the respective public health officials in both provinces about next steps and if a border requirement, as they currently have, is really necessary.
Can you give us more details on the vaccine passports and how those conversations are happening? So a timeline for people who will get to, is it cabinet that will discuss that and decide? And are you looking at the type of vaccine passport where it would be required to walk into a business?
Well, there's, I guess, several answers to that. One is in relation to the federal, push right now. I mean, I know it's an election discussion about the need to have a national vaccine passport. We are looking, I know Quebec have done this, Ontario are doing this, and west of BC are doing this. We are looking at what it would take for us to have a vaccine passport, but it's kind of like going into My Health and being able to verify that you have a vaccine. I think what we're going to find is that basically if you want to travel outside of New Brunswick, it may become necessary. You know, if Quebec is requiring a passport, then they're likely going to require a passport for New Brunswick travelers. And so we want to harmonize that and make it compatible with the national kind of a recognition. And I think that's where it'll evolve, because if Quebec and Ontario, BC, and other provinces, we haven't had this discussion with Nova Scotia but we would as part of an Atlantic Health approach. That's where it'll be, is that we'll want to have mobility back completely. And if our residents are restricted because of the need for verification on a standardized basis, then that would be the impetus to do that at this point. Other than that, right now, we're quite comfortable with where we stand.
So just to be clear, no thoughts of a business related.
Businesses would have a choice to, if we introduce this, they would have a choice to say, look, I would like to have verification of a vaccine. And if people couldn't provide that, they may say, well, we would ask you to mask, take extra precautions. But we want to be in a position where we're clear on what the provincial requirements are, as Dr. Russell has outlined, as I've outlined here, and give people who are comfortable in one manner or another the flexibility. But as far as the regulatory requirements, it's clear. We're in green. But we want people to feel comfortable in their own space.
Thanks, Laura. Silas?
Just to continue on that with vaccine passports, Ontario's announcing theirs today. It looks like Quebec began theirs today. I'm wondering, I guess, what would be the trigger for you or for public health where this would become necessary in New Brunswick, as you mentioned, if you feel that it's necessary to go this way or to bring in mask mandates, you will. What exactly will that be? Is it hospitalizations? Is it ICU admissions? What is it?
So I think this is a question we probably both can answer in relation to our respective positions, because for me right now, given where we are with the pandemic and where we are with the case counts and hospitalizations, it would say no further action required to ensure that we encourage more vaccinations, because we're seeing more vaccinations right now. Our numbers are going up, but they're not where they need to be. So we want to see, is that trend going to continue? So we've had, I think, roughly a 25% increase in the last few days in vaccination rates. So that's really good news. And 2,000, the other day, I didn't get today's numbers yet, but 2,000 were new, first time. So that is good to hear, and obviously a younger age group. So I think where it gets down to, if things remain the same now and we're happy with vaccination rates and they continue to increase, it gets down to, okay, are we restricted in traveling? Because Quebec have put theirs in place to get people vaccinated. BC's done the same thing to get people vaccinated. And so yes, if we are short and we're not meeting increased levels of vaccination, then we may have to do it. And that would be a trigger that public health would recommend based on where we are. If it becomes a mobility issue that our residents cannot travel in other provinces, then they will want some sort of identification that's recognized in other provinces. And that would be the impetus for doing so. So there can be two factors. So right now we are looking at what it would take to have our own registration that would be acceptable. It would be online. Would be able to show it, as on our smartphone, or QR code or whatever. But it would be based on not ensuring that our people can move freely throughout our country.
Silas, do you have a follow-up?
Yeah. So just to be crystal clear then, a vaccine passport in New Brunswick would never be like it is in other places where you cannot access non-essential services if you are not vaccinated. So, for example, you can't, you can't go out to eat unless you're vaccinated. That's not what a New Brunswick vaccine passport would be.
Well, I would never say never to a lot of things, but I think that in relation to that, it's like right today in our situation, we would not see the need to that, and people can take their precautions at the, under the green banner that we are now. But I would say that, if we saw an outbreak, if we saw a situation with the Delta variant, and I encourage Dr. Russell to respond to this as well, that could change what's required in order to ensure that we don't continue a transmission and exposure. So could it happen like Quebec? It could. Is there a likelihood given our current path? Well, I'd like to say that it would look like that's not going to be a requirement, but the Delta variant is still there. There's always a concern. We're opening up more, going back in schools, and that's why the protocol in schools is going to be important, and that's why vaccination rates continue to be important. So we always have to leave our options open.
Do you want to speak to that?
Yeah, I mean, I agree with the fact that anything that incentivizes people to get vaccinated is a good thing. As we know, there are different ways of calculating the levels of population, the percentage of the population that are vaccinated. Some people use the absolute number, some people use the eligible population. But the bottom line is that the higher number of the people that get vaccinated, the better in terms of protecting the entire community, in terms of protecting the vulnerable populations that can't get vaccinated or immune compromised, and protecting our healthcare system.
Thanks, Doctor. Kevin?
Premier, there's people that live along the Brunswick-Maine border that are wondering when they'll be able to drive across and visit their relatives on the other side. What are you hearing from the federal government as to what's holding that up?
Well, I'm wondering if I'll ever be able to drive across. I'm one who's double vaccinated with AstraZeneca. And at this point, as far as I know, it hasn't been recognized in the U.S. So I'm saying, well, maybe that's an issue, but Prime Minister Trudeau's in the same boat, I guess, in that regard. We aren't hearing an update on that, and so I'll defer again to Public Health and Dr. Russell. If there's any news in that front, we've seen an extension of the current about a week ago, another extension. But I am getting a lot of pressure. I know it was alleviated this summer a bit with us allowing people that were from the U.S. to come and see friends and family and relatives, but it wasn't reciprocal. And now we're getting, we're pushing back, through our intergovernmental affairs and basically when is this going to change? And it really escapes me as why the U.S. think we are a risk to their population because it really. It seems like it's the other way around. But we restricted those that are double vaxxed to come here. That was our criteria. And it seems that should be the same. And I know the federal government's working on that, but there hasn't been any movement that I'm aware of at this point.
I'm not aware of any changes upcoming right now. However, with respect to all international travel and the issue around either mixed doses or AstraZeneca, we are having discussions around if we are able to start offering third doses to those individuals. We don't have anything firm at this time, but we're certainly looking to our neighbors in Quebec who have done that and what their approach has been.
And I guess a follow-up is in regards to third doses, where are you with thoughts on that and people that may have some compromised issues?
Right, so that's been on the table for several months, actually. We were waiting for NACI to give recommendations on when to start that. However, what we know right now is that for those people who are immune compromised, meaning somebody who is a transplant recipient of solid organ donation, those types of situations, we won't be calling them boosters, we'll be calling them third doses, meaning that they will need 3 doses to complete their series to be fully protected against COVID-19. So that discussion is happening. We're waiting for some decisions and logistics and operationalization pieces around that to be in place before we can move forward. And we're also looking at booster doses, and we would like to start with the individuals who are in long-term care facilities who would have been in that first cohort. There was about 3,000 people in that first cohort of people who were vaccinated very early on, because we know that for those first people who were vaccinated, it'll be important to get them done first, but also because we also are aware of that population. Some of them had the 16-week window between the two doses, and some had a very shortened window. And one of the reasons that in Israel they're giving third doses right now is that they all had the 21-day window. We didn't have 21 days at a minimum. We had 28 days as a minimum. But in terms of the immunity that is conveyed in those types of situations, again, we're monitoring all of this information from other jurisdictions, and we're going to review our criteria and timing and looking at the best evidence. So more to follow.
Thanks, Kevin. Vicki Hogarth, CHOC TV.
Thank you. Premier Higgs, the seasonal Campobello Ferry usually ends its services in early fall, and residents are concerned about this winter. Will you be working with East Coast Ferries to extend ferry services into the winter months once again this year? And can you assure people on Campobello that they will be adequately connected to the mainland?
When we continued the service last year, it was as a result of us still being under a restrictive COVID rules and regulations and the emergency order. We want to see activity in the U.S. so the Campobello residents can move freely through Maine back into New Brunswick, as they always have done over generations. So that will be where we'll be moving, is back to that level, but I want to be sure that the freedom moving through the U.S. is back to normal. So any extension of the ferry would depend on what additional restrictions are on residents that they would be not used to based on their experience over many, many years. We'll assess that situation with Maine, and my hope is that by the time the ferry season ends, that we will have free movement back and forth as we have enjoyed for many years.
Did you have a
Premier,
follow-up?
you mentioned, I do, thank you. Premier, you mentioned you've had 2 doses of AstraZeneca, and that could potentially restrict your travel into the U.S. Quebec has offered a 3rd dose of a vaccine to people who either had 2 shots of AstraZeneca or mixed vaccine doses who want to travel where mixed doses aren't recognized. Would you consider doing something similar in New Brunswick at people's own risk if they'd like a 3rd dose in order to travel to places?
Yes, Dr. Russell gave me my 2nd dose, and I didn't feel things. So if she recommends my 3rd dose and she's willing to give it to me, I'm there.
Thanks, Vicki. Timothy Jakes.
Yes, sorry, unmuting there. My question's for the Premier. It's the ICU at the Campbellton Regional Hospital is closed until September 6th due to a staffing shortage. To keep the ER open. The local MLA and the chair of the Restigouche Regional Service Commission both say staff should have been brought in from elsewhere in the province to keep such a vital service as ICU open rather than ship very sick or badly injured people to Bathurst or Edmundston. During a COVID outbreak here, staff was brought in from outside the area to help. Why couldn't that have been done here?
I think what we're realizing has become more pronounced in the last several years is that we have an ongoing crisis in healthcare. We have a situation that demands are exceeding our ability for service. We're seeing that we're going from a pandemic into a recognized health crisis that both sees shortage of staffing. It sees a necessity for our health groups, both Vitality and Horizon, to work very closely together to ensure we can continue not only to meet the standards of health that we demand, but to enhance them. So, it sounds easy to be able to transfer people around, but I think what we're seeing is that the numbers of people to transfer are getting less and less with more retirements. And so we are going through that across the province. We've seen changes in ER levels. We've seen surgeries because of the lack of staffing. So I think what it's saying to everyone, and it's certainly saying it to me, is that we have to look at the big picture here. We can't take any facility in isolation. We have to manage our healthcare system as an entire group so that we're saying, how do we get the best? And we have to face the reality. My first discussion with Premier Houston was based on what he, putting forward in his campaign about fixing healthcare. It is, it will require more money, but money is not the only solution. It requires innovation, and it requires the ability for us to manage a healthcare system that is increasingly having more demands given our demographic, and is increasingly putting more and more stress on employees. Employees which every province is in search of. Every province in the country is going through this. So I know we need to look at the coverage in that region. We need to make sure that at the very foremost, that the regional employees have a place to get the health care they need. That has to be job one. And then how do we maximize the use of our facilities to achieve that everywhere? It's not an easy solution, and it's not about just doing business as usual. It's about addressing the big problems head on and finding a solution. And we're working with the authorities to do that because it is certainly not business as usual. We've gone from a pandemic into a health crisis.
Tim, do you have a follow-up?
Yes, I do. The ICU closure came after a temporary closure of 12 other beds in the hospital until later in September, another unit, and also due to a staff shortage and also to keep the ER open. We know there's a chronic nursing shortage in this zone. One way it was put to me is that when your roof is leaking, you may need a new roof, but you have to do something about the flood in the meantime. So I'm wondering what the government has in plans to deal with these challenges on a short-term basis, even though reforms are coming later.
Well, I guess what I would want to understand, and it is my current understanding, that we are able to provide the service. It may not be as convenient as it once was, and we will hope to be able to improve on that. But we are indeed meeting the needs of the area by having an alternate path. It'll require higher utilization of advanced care paramedics, of our system, our entire network, whether it be extramural. We'll be doing a lot of this in terms of managing a changing environment around healthcare. And my understanding is it is inconvenient, but we are managing and having a place for people to go when they need it the most.
Thanks, Tim. Adam Huress?
Adam,
are you there? Okay, Andrew Waugh.
thanks. Premier, you kind of seem to be going back and forth on being definitive about whether New Brunswick's going to have a vaccine passport. Well, Quebec's already done it, and Ontario's going to do it as soon as today or tomorrow. Why not just say, yeah, we're going to do it?
We've asked public health and our officials in IT to look at what that would entail. We'll be bringing that to cabinet in the coming weeks. We don't have the urgency that Quebec or Ontario have because their level of hospitalization, their outbreak of cases, their intensity of population is very different than ours. So it's not an example of they're doing it, we're doing it. It's a process of saying, okay, what's it going to take for us to do it? How does it interface with other, let's say, apps or other identification? Is it a standardized policy? The federal government is pushing for a standardized policy. So when we put it in place, we do it right. I think it's likely will come, but there's not a sense of urgency here. And so the important thing for us is to do it right. So if there was a sense of urgency, we'd be reacting today, but right now there isn't.
Andrew, you have a follow-up?
Yeah, I'd like to know what the case and hospitalization projections for the fall and winter are, if you have them. That'd be good to know.
Hi, Andrew. I don't have modeling projections at this moment in time in front of me that I can share. So no, I'm sorry, I don't.
So have they been done?
Well, I think in a general sense, we look at the Canadian modeling. So that the Canadian modeling has been done. I'm not sure if it's been published, but certainly that's what we've been looking at. I think it is a moving target in terms of what we could see happening moving forward. So we're as of right now, we're in surveillance mode and watching the numbers. And as you know, our focus really is on hospitalizations and ICU admissions versus case counts. I think roughly right now we're seeing 1 in 50 cases being hospitalized, and the average number of days in the hospital for COVID patients is about 1 to 5 days. You know, and it's primarily in unvaccinated people. So just coming back to what Dr. Bonnie Henry said, that moving forward, as of, you know, what the picture looks like right now is that the more people we get vaccinated, then the lower those risks are going to be, and the projections would obviously be based on higher numbers of vaccinations. That can change if there's variants that don't respond the same way to the immunity that the vaccines provide. So we'll continue to monitor for that as well, and we'll continue to evolve as necessary. But as of right now, again, our primary concern is getting our vaccine numbers up as high as possible, and obviously with going back to school, there's a lot of push right now for that, and again, the uptake has been good throughout the last several weeks as we move forward. The walk-in clinics are, with respect to walk-in vaccination clinics, they're having great uptake, so we're being able to reach people that way. And with respect to vaccine passports, you know, in all likelihood, if that's the way things go, then it is a good idea to get vaccinated ahead of that, as opposed to waiting for that to kick in, if that's the case.
Thank you.
Andrew. Pascal Rachnog, Radio-Canada.
Oui, bonjour. Ma question est pour le Premier ministre. J'aimerais savoir, récemment, vous avez dit que vous n'imposiez pas la vaccination obligatoire aux secteurs financés par le gouvernement, comme les foyers de soins, par exemple, mais que si ces secteurs-là ne suivent pas les mêmes consignes que la fonction publique, vous pourriez réglementer. Pouvez-vous nous dire où vous en êtes dans cette réflexion-là? Avez-vous l'intention de réglementer pour forcer certains secteurs d'adopter la vaccination obligatoire?
Well, we've certainly said that the plan is that vaccinations are mandatory, or there is a testing regime to ensure that the virus is not coming into these homes or coming into the government employees, and the universities have adopted that program. Our Part 4 Crown Corps have adopted that program. So if it comes down to the point, if I understand your question particularly, if it comes down to the point that people say, well, I'm not getting vaccinated and I am not going to be tested, we will not put the residents at risk, then it becomes down to an employment issue. So I don't think there should be really any confusion around that. Someone who doesn't want to get vaccinated but will not protect the residents or the people that they're serving, it's a problem. And so following the rules of wearing masks and getting tested, if that's refused as well, then we will have to look at the next step.
Pascal, avez-vous une suivi?
Non, c'est bon de mon côté, merci.
OK, merci. Simon d'être l'Acadie Nouvelle.
Oui, bonjour. J'aimerais une question pour Monsieur Higgs. J'aimerais savoir finalement dans la fonction publique quelles sont les règles en place actuellement concernant la vaccination, qui sont concernées et quelles sont les modalités en place.
Well, right today, as a memo that we put out for all government employees, is that they needed to be vaccinated. There might be exceptions there in relation to health conditions, but we'd see very few of those really. And if they were not vaccinated, then they had to be wearing masks and they had to be tested 3 times a week. That, you know, depending on the severity of a situation, I mean, if we were looking in hospitals and serving clients, we're looking at surgeries and patients, it could become more of pronounced. But as I just said, that we cannot put people at risk. Currently, the unvaccinated population is putting our society at risk. As said many times this morning, it is a case of a pandemic of the unvaccinated, to quote Dr. Russell and the Chief Health Officer of BC. So it's like, this is a problem that has a cure. This is a problem that has a solution. And so it is really concerning when a solution is facing you right in the face, but you refuse to acknowledge it. So I think we are encouraged by what we're seeing for level of vaccinations over this last 2 weeks. We're hopeful that will continue over the next several weeks and that this will become less and less of a problem. But as we have reacted throughout this pandemic, based on the criteria that's available and the need at the time, we will continue to do so going forward.
Simon, avez-vous un suivi?
Non, merci.
Merci. Elizabeth Fraser, CBC.
Hi there. My question is for Dr. Russell. So epidemiologists have told us that there's nothing really special about the 75% number for the vaccination rate. So what is the goal now, and what specific rate are you aiming for to feel comfortable?
So obviously the highest number possible. And again, there are some jurisdictions that measure it by the eligible population, and some people measure it by the total population. So again, once we are able to vaccinate children under 12, that will be great in terms of including more people in the eligible population. But we know that the best protection right now is vaccination, and we know that with the current variants and whatever potentially new variants are emerging, the higher number, the higher the percentage of the population, total population or eligible population that's vaccinated, the better. Again, we've always been trying to protect our population, our vulnerable populations, and also our healthcare system. You know, 75% was a target, and it was a good one to aim for. And now the message is really about, again, the more the better.
Elizabeth, do you have a follow-up?
Yes, I have another follow-up question for Dr. Russell. So again, last week after the announcement of 14 community spread cases, it was strongly recommended we wear masks inside public places. And it doesn't seem as pressing today. Is it no longer a strong recommendation?
Well, throughout the pandemic, there's been so many changes and evolutions of the virus itself and the epidemiology in terms of transmission and where we're seeing it. And we are in a new phase. So being in the green phase is a whole new learning process in terms of what we're observing and continuing to do our surveillance. So when the case numbers go up anywhere at any time, regardless of what else is happening, I think people need to be aware. I mean, that's why we publish the numbers, and that's why we want people to be aware of what layers of public health protective measures they can still use. Once we went to green, because the mandatory order was lifted, it meant that these things were no longer legislated and had legal consequences. But at the same time, you can still have consequences to your own health, your own personal health, and your community members, as well as impacts to the hospital system. So those layers of public health protections measures are still available to everyone. We do still encourage everybody to wear masks in certain situations for sure. Obviously, people who aren't vaccinated are at higher risk. If you have somebody in your household who's vulnerable or who hasn't been able to be vaccinated for whatever reason, we definitely encourage that. But certainly, if people's anxiety level is up because they are aware that there are more cases in their area, it's not a bad idea to make that choice. We do have, as I mentioned, the Living with COVID document that has excellent information about how to live with COVID as we move forward. It will continue to evolve. And there's also a document from Public Health Agency of Canada that does also help identify helpful information to help you make choices around mask wearing. So, and as the Premier said, we're not ruling out that we would ever bring back mandated mask wearing. At this time, again, it's a choice, and we're very supportive, and we want the entire population to be supportive of that choice.
Thanks, Elizabeth.
Thank you. Thank
Jordan Gill, CBC.
Yes, this question's for Dr. Russell. You've occasionally been reporting on how many of the positive cases have been in unvaccinated people, but why don't you indicate how many of the unvaccinated people are ineligible because they're either too young or unable to get vaccinated for medical or other reasons? And will you start to include this data on the dashboard?
That's a great question, and I'll take that back to my team.
Have a follow-up?
Yes, I do. I guess this is either for the doctor or the premier. You said at this time, I guess the premier said this time, vaccine passports and mask mandates are not necessary with the situation we're in New Brunswick. Can you tell us exactly what the province would need to see to implement passports and mask mandates? And by exactly, I mean specifically, would you have to see a active case number? Would you have to see a hospitalization number? And could you give us those numbers? Like, say, we need to see 40 people in IC before we implement those measures, or whatever those measures, that number may be.
Well, as we keep saying, the situation is constantly evolving, and yes, before we would base information and decisions and policy recommendations around actual case numbers, but because we know that the case numbers don't translate into the same number of hospitalizations with the increased number of people being vaccinated, that will continue to evolve as well. We already know what it takes to stress the system. We saw that in the outbreak in Zone 4 when we had about 13 hospital admissions at one time. Do I have an exact number? No, I don't have an exact number, but certainly a trend in the wrong direction would be impetus to further that discussion and formalize our recommendations that way.
Thanks, Doctor. That concludes today's update. Voilà la fin de notre mise à jour. Thanks, everybody. Merci.